Dr. Limongelli, let's talk about dentures, and specifically lately in the news there has been a lot of negative news about denture creams, or adhesive as they are called, and in specific one is called Fixodent. Now, they probably all do, and the negative news there was that they have lots of zinc in it, and while zinc is a good thing for the body, apparently when you have it day in, day after, in your mouth at the gateway of the blood vessels, too much of it goes in the body, and some people claim that quite some people have major nerve damages, which handicaps them physically. They cannot move anymore, and literally mentally and or. Now, it's not 100% proven, as we know. Nothing like that ever gets proven very fast, but the fact is there is some concerns out there. What's your take on it?
Well, there have been a couple of patients that have complained about neurological problems. These patients eventually wound up in wheelchairs, and that's when it hit the news and it was broadcast. Evidently, the Fixodent does have a high concentration of zinc, and the zinc interferes with the copper metabolism of the body, creating neurological problems. And for that reason, these people feel that they've been using the Fixodent over a long period of time, and with the blood tests and things that they went through to diagnose the zinc poisoning, they related the zinc poisoning to the wearing of that Fixodent over a long period of time. Patients that have dentures, as the mouth has a denture over a period of time, the bone resorbs. And as the bone resorbs from the beating of the bone from the plastic of the denture over a period of years, the denture naturally gets loose. It's recommended that dentures be replaced every 5 years and relined every 2 years to compensate for that. Unfortunately, a lot of patients don't adhere to that. Some patients that I have been wearing dentures 10 years or more without ever seeing a dentist in the interim. They use Fixodent or the denture adhesive creams or powders to help to keep the denture in. And as we see recently in the news, the Fixodent had a deleterious effect. One way that denture wearers can be helped, especially with the full lower denture. The full lower denture almost never can be retained well. It almost always needs some type of adhesive, because unlike the upper denture, which achieves a suction fit across the roof of the mouth, you don't have that in the lower jaw because of the tongue. One way to secure that is with 2 implants, which are usually placed in the area near the corner of the mouth into the bone. And the denture has a little O-ring attachment that snaps into a ball abutment that's screwed into the implant. So the denture actually snaps in place. It won't come out. It won't become dislodged. And instead of getting all implants throughout the whole bottom jaw with a fixed bridge, which is very expensive, this would only use 2 implants to do the same thing, and you'd be able to wear the denture over it.
Great. Now, so basically what you're saying, there's this hybrid of a denture where, you don't have all the implants, which cuts down on lots of money. You have a couple, maybe 3 or whatever, and by doing so, you bring the price way, way down, a little more than a denture, but the fit of it is a lot better. So let me tell you, when a person has such a denture-supported, an implant-supported denture, that I guess would be the word,
yes.
Can he now eat an apple and chew on a spare rib?
Yes, he can.
So basically, he is pretty much coming very close to having his own teeth and or an implant. For all purpose, it's a world of difference to just a normal denture.
It is a world of difference because without it, even with adhesives, sometimes the denture tips.
Right.
Especially when you bite on the front teeth.
Right.
Most of these patients are instructed to chew on both sides in the back at the same time and not chew on one side or in the front, which causes the denture to tip and dislodge.
Right.
With the implants to help it gain retention, it stays in place. And
Beautiful.
now you can chew more normally again.
Beautiful. And you don't, because, I mean, I don't know, I never had it, and hopefully, well, most likely will not, but, you know, having that adhesive in there and just a little wiggle walker, that couldn't be all that comfortable, you know. Never mind that maybe, perhaps, potentially, it's even poisoning you. Now, also, you mentioned that on the upper, you know, that's a little better because the upper denture keep fitting a little longer, a little better, but due to the suction on the palate because of that plastic, but wouldn't that also at the same token take away the taste? So if you eat a nice, whatever it is, you know, a radish or a good gourmet type of thing, wouldn't, you know, most of us think we taste with the tongue, and there is some tasting with the tongue, but the truth is the main tasting comes up on your palate, and if that's covered with plastic, wouldn't that take away from the pleasure of eating? And that would be really bad to me. I mean, I like eating too much, maybe.
Well, it does. What happens, the plastic creates an insulator, which does not conduct the temperature changes of the food. Like if you drink hot coffee, you don't sense it as much. And you know there's something artificial there. One way around that was to get a full upper denture with a cast metal palate. The cast metal palate is made out of a wafer-thin piece of metal. Very thin, and it does conduct the temperature changes faster than the plastic does. So a lot of patients find that one a little more comfortable. It's a little more expensive, but it's a little stronger also. And for patients with a very hard bite that sometimes crack the plastic denture, the cast metal palate is the only denture they can get.
Right. But all that is totally eliminated because you still then can't taste it. You know, that good little sauce going, you know, how you kind of like move it in the back and go, So, but the denture implant, so the implant-supported denture takes all that away, and you have nothing there anymore to cover your palate.
With an implant-supported denture in the top, it's usually recommended you have about 4 implants, 2 in the back and 2 in the front.
Right.
The denture would look just like the bottom denture, a horseshoe with the middle open. It can snap over the implants, and the entire roof of your mouth will be open.
And you can now taste the food. You can taste it. You can burn yourself again with a cup of coffee. I mean, you know, it's only when you don't burn yourself anymore that you start missing it, you know. And you can taste it, and also perhaps these days, due to the findings, perhaps more importantly, you don't poison your body, and you don't have that gluey type of stuff in it, and you feel comfortable, because, you know, when we start feeling that something, you know, kind of tips off of you, that's when you start feeling uncomfortable and stuff. So that looks like a really wonderful solution, you know, affordable still, and yet doing almost the job of a full implant or of real teeth. Absolutely wonderful. Thank you very much. And by the way, should people who have had this adhesive for a long time, used it too much, and if they just feel some numbness in their legs, in their finger, in their extremities, if they feel some a muscle weakness and stuff, should they go and visit a nerve doctor and see like what is going on, and probably at the same time a dentist to kind of like get them the implant supported denture so they can get off that constant poisoning?
That would be an excellent thing for them to do. Stop using the Fix-A-Dent, see a neurologist, and get the nerve problem diagnosed, and see a dentist so he can get you properly fitted dentures.
And in terms of seeing a neurologist, he could also, of course, go to his physician, explains it all, and that his private family physician would direct him to the right area, I suppose, right?
Yes, yes.
Mm-hmm. Beautiful. Thank you very much for the insight. Very helpful, Dr. Limongelli. Bye-bye.
Bye-bye now.